سيداتي وسادتي، طبعا الجودة والسلامة بدون الاستدامة ما ممكن يكون لها معنى. بيشرفني أقدم بداية الجلسة الثانية بكيفية بناء واستدامة رعاية إكلينيكية منسقة وفعالة. مديرة الجلسة صديقة وحبيبة وشخصية بعتز بمعرفتها، الدكتورة نوران غندور، هي برضو عضو مجلس إدارة الهيئة العامة للاعتماد والرقابة الصحية. المنبر إليك دكتورة نوران.
السلام عليكم، مساء الخير. شكرا جدا دكتور نادية شعير. بشكر جميع الحضور. We are going to start our second session. The title of our second session is How to Build and Sustain a Consistent, Right and Effective Clinical Care. First of all, I would like to introduce our panel experts. We do have Professor Dr. Samar Abu El Saud. She is a healthcare leader who brings more than 28 years of experience in the aspect of quality and performance improvement and strategic leadership. She's the chairperson in the Association of Medical Education in Europe, a board director of the Global Alliance of Medical Education, a member of the Academy of Medical Educators, a fellow of the Higher Education Academy. She was selected as one of the best 100 chief executive officers in the Arab world 2017, and granted the British Council UK Alumni Award 2019. You're most welcome, Dr. Samar. Let me introduce my colleague, Professor Dr. Abdelhamid Adaya. He is a leading figure in the field of evidence-based medicine and guidelines development in Egypt as well in the Middle East. He is the founder and the first elected president of the Arab Federation of Evidence-Based Medicine, a Cochrane author and reviewer of many publications which are related to evidence-based medicines and guidelines. He's the head of evidence-based medicine unit, Cairo University, and he is the Secretary General of the High Committee of Medical Specialties, advisor for the Minister of Health. He was of Health and Population 2014 to 2016, a member of Higher Committee of Research Ethics, a member of Scientific Council of Health Informatics, a board member in the Medical Education Development Center, and past technical advisor of the National Population Council. You're most welcome, Dr. Ataya. Let me introduce Mrs. Nancy Dixon, and she's going to be online with us from the UK as a panel expert. She's a consultant in the subject of measuring, improving, and accounting for quality and safety of the healthcare services, a director of strategic services for Healthcare Quality Quest, the author of many books which are related to auditing and guidelines and quality improvement. And she trained as a psychologist with many qualifications: CPHQ, Fellow National Association for Healthcare Quality, certified in Medical Quality, American Board of Medical Quality, Fellow Chartered Quality Institute, UK, Member Q, the Health Foundation Quality Community, UK. Mrs. Dixon, you are most welcome to be with us today. Lastly, we come to our Vice Chairman of GAHAR, Dr. Islam Abu Yusuf, one of the pioneers in the international accreditation for hospitals in Egypt. He diploma in Total Quality Management, American University in Cairo. He has extensive experience in evaluating as well as in implementing the standards, whether we are speaking about the Egyptian standards or Sibahi or the Arab standards. He's a faculty member in the Quality Diploma in the American University and an instructor of MBA also in the American University. And in addition to all this, he is a consultant in orthopedic and spinal surgery. You are most welcome. Let me start with a very short introduction about regarding our session. Achieving a complete and accurate medical outcome requires both efficient and effective healthcare delivery process. In this era, the accelerating growth of medical knowledge necessitates improvement to both the efficiency as well as the effectiveness in the healthcare delivery process. Hospitals today face greater pressure than ever to deliver high-value services cost effectively, while ensuring their patients they are receiving the excellent care experience. Yet, decreasing revenues, rising costs, and growing expectations from the patients, they make that prospect challenging. Meeting these challenges requires that hospital administrators as well as the clinical providers, they have to work together to find forward-looking solutions to improve the patient care and manage costs without sacrificing the quality of the service. What's efficiency in healthcare? Healthcare efficiency is a comparison of the delivery system outputs with the inputs. Efficiency can be reported then as a ratio of the outputs to the inputs, or a comparison to optimal productivity using analysis of data. Efficiency measures whether the healthcare resources are being adequately used to get the best value for the money. Healthcare can be seen an intermediate product in the sense of being a means to the end which we need to reach, which is improved the health. Efficiency is concerned with the relation between the resources, which are the input, different types of resources, and the final health outcomes with the different types. A long-term continuous focus on efficiency and productivity is essential in order to ensure healthcare quality and consequently more patient satisfaction. What is clinical effectiveness? Clinical effectiveness is a collection of activities and tools which are based on research and measurement that are used to improve the quality of healthcare. These activities include, but are not limited to, guidelines, audits, research, as well as adequate evaluation. The aim of clinical effectiveness is to ensure that the healthcare practice is based on the best available data and evidence of effectiveness. It's a key component for improving the patient safety and the quality of healthcare service delivery. How does clinical effectiveness work? Clinical effectiveness uses information gathered from national as well as international research and audit to identify what practices are safe, effective, and efficient. It brings this information together to draw conclusions that help healthcare professionals to make decisions about what is best for the healthcare system and its individual users. Thus, the implementation of standards of clinical practice can improve health outcomes for patients. They can reduce variation in practice, and in addition, they improve the quality of clinical decisions that the patients as well as the healthcare staff have to make. This will inform the patient about the care they should be receiving and assist them to make healthcare choices based on the best available information. Sustaining efficient and effective clinical care is considered one of the most major challenges in achieving a high level of patient satisfaction. This session will focus on the main safeguarding mechanisms to attain this goal through different activities. We are going to speak as many activities that we are going to do or perform in order to reach our goal. The activities include having the right healthcare professional, evidence-based practice, having clinical care standards and the importance and the benefits of measuring their effectiveness, having an integrated care delivery system, and disclosure and transparency. The delivery of safety and quality healthcare depends on the effective organization of the health workforce, the HR, the physicians, the workers in this state. Thus, health service organization must have adequate strategies